In the previous session, we have seen the pre-formulation. What is the different parameters that you have to take into consideration before the formulation of drug? That characterization of particles, crystallinity, polymorphism, crystallinity, partition coefficient, etc. Type of powder, type of flow, etc. Angle of purpose, Car's index, etc. We have seen. So all that kind of parameter you have to take into consideration while designing any kind of dosage form. So after that, we'll see today tablet chapter and whatever important points are there from tablet. So types of tablet, granulation techniques, then diluents, each different type of diluents and their examples, their roles, their concentration, etc. Then tablets granulation we will see what is dry granulation, what is wet granulation. After that, we will see tablet tooling and etc. Quality control test for tablet. And so let's start. So here today we are going to see tablets, and it is a very important chapter for your GPAT as well as Niper and other exams also. A lot of time they used to ask question on this, and it is very important chapter. You can you can expect at least three questions, at least three questions from this chapter. कम से कम तीन question. So 4 into 3 12 marks. So pharmaceutical tablets. So first of all, I'm not going in the detail what is tablet, what are the advantages, what are the disadvantages, because that part is important for your semester exam. They used to ask question in your exam like write a note on tablet. Okay, so in that you have to mention the definition, types, then advantages, disadvantages, and all that. In case of GPAT, they will not ask you such kind of questions. In the GPAT, they are not going to ask you the advantages, disadvantages, demerits, merits, and all that. Okay. So here, what is important? So that will be taken here. We'll see. First of all, you should know simply definition of tablet. So what do you mean by tablet? Tablet is nothing but the oral solid dosage form made by compression or molding. There are two types. There are two ways to make a tablet. There are two ways to form a tablet. Tablet is nothing but the a solid unit dosage form. Unit means what? So that can be taken by in a number. For example, 1 2 3 4. जैसे आपको कोई सफरिंग हो रहा है या फिर कोई डिसीज है, आपको हाइपरटेंशन हो जो कोई, उसके बाद में आपको टैबलेट प्रेस्क्राइब करते हैं कि बीडी टीडी वंस अ डे, ट्वाइस अ डे, थ्राइस अ डे, एक टैबलेट लेना है, दो टैबलेट लेना है, कितना लेना है, वो आपको फिजिशियन बोलते हैं. सो इट इज अ सॉलिड यूनिट डोसेज फॉर्म मेड बाय compression or molding, and it is taken in the numbers 1 2 3. So that's why it is a solid unit dosage form. There are different kind of tablets. Initially in the old age, or in the ancient time, it was made by a molding. Molding means by using different kind of molds, or वो उसको मराठी में साचा बोलते हैं. So but nowadays all the tablets they are made by compression only. Okay, by using a tableting machine, tablet punching machine, and rotary tablet press and etc. We'll see it on upcoming slide. So tablet again is nothing but the oral unit dosage form made by compression or molding. So it has advantages, disadvantages. If you want to see that, you can read that from books. Okay. So main advantage of tablet is nothing but it is a temper proof, little bit temper proof. It is its palatability, cost effectiveness, ease of administration. So anybody can take tablet and just it can swallow. He or she can swallow. So no patient incompliance. So suppose that आपके पास टैबलेट है, आपके पास कैप्सूल है, और आपके पास क्या है, सिरप है और इंजेक्शन है. ऐसे 4 5 डोसेज फॉर्म है, तो आप कौन सा प्रेफर करोगे? क्यों? सर टैबलेट के साथ टैबलेट आप इजीली मुंह में रख के निगल सकते हो. कैप्सूल कैप्सूल भी निगल सकते हो, लेकिन कैप्सूल में थोड़ा बहुत फॉर्मुलेशन एंड कॉस्ट ज़्यादा आता है और टेम्परिंग का भी प्रॉब्लम आता है. So tablet जो होता है वो टेम्पर प्रूफ होता है. Capsule is little bit less temper proof as compared to tablet, but and again capsule dosage form is a relatively costlier. So if you want to make a capsule, so you will have to spend a lot of money, because see, for capsule you need a gelatin shell, empty gelatin shell or sheets to make a capsule, or empty sockets of capsule. So for that also you are paying amount. Again for printing, embossing on the capsule shell, you need a extra amount. But in case of tablet, what is there? Just drug alone, or drug with excipient. Mostly drug with excipient. It is they are formed in the form of granules, and they are compressed. Okay, so it is nothing but the tablet. Then again for suspension also you need a, there are different disadvantages of the suspension. Stability problem is there, suspension immersion or liquid oral dosage form. Stability problem is there, again handling problem is there, and again accuracy of dosage. So in the tablet accuracy of dosage ensured. Okay, so in case of tablet accuracy of dosage ensured, जैसे आपने 10 मिलीग्राम या 50 मिलीग्राम या 500 मिलीग्राम का टैबलेट है तो उसमें मैक्सिमम डेविएशन कितना होगा 0.1% मैक्सिमम, मतलब इट इज एक्सट्रीमली यूनिफॉर्म इन द कंटेंट. ओके, इसमें जो ड्रग है उसका यूनिफॉर्मिटी रहता है, तो ईच एंड एवरी टैबलेट में यूनिफॉर्मिटी. देन अगेन इफ यू टेक एग्जांपल ऑफ योर सिरप, सिरप अगर लेंगे तो मोस्टली द सिरप्स आर they are repeatedly administered in the particular volume like 5 ml 10 ml. Okay, and there is always a error in the dosage form while taking a particular ml or particular volume. So patient may differ, or it may differ in the measurement, it may differ in the, because see old age people जो बूढ़े लोग होते हैं उनको क्या है कि उनका उतना कोऑर्डिनेशन नहीं रहता, उनका आई साइट उतना नहीं रहता, so they may take a less dosage or they may take a more dosage. So there is not a accuracy ensured in case of liquid orals. But tablet आपको क्या करना है 400-500, वहाँ पे 500 मिलीग्राम का टैबलेट है, वो ले लो पूरा के पूरा 500 मिलीग्राम ड्रग आपके बॉडी में आ जाएगा. So tablet ensures uniformity of dosage. Then again it is a temper proof. Okay, and by employing the various type of coatings you can modify the physicochemical organoleptic properties of your tablet. Also you can modify the uh, other properties also. Okay, then in case of injection, so you cannot take injection by your own because it is not easy, because you are not skilled for that. Okay, so tablet is having certain kind of advantages. I'm not going in the detail, I have just highlighted few of them. Classification of tablet, so they can ask question on this also. Classification of tablet, so tablets are classified into different way. Okay, so tablet are classified according to their route of administration. Okay, so those tablet which are taken orally, those tablet which are taken orally, those tablet which are taken by, those tablet which are ingested or taken by orally. Okay, or consumed by orally. Then those tablet which are placed in the oral cavity. And third is nothing but the tablet for other routes like implants, rectal tablet or renal tablet, etc. So first, tablet used or tablet taken by oral routes, orally ingested tablets. Okay, so what kind of tablets are there in the orally ingested tablet? There are different kind of tablet which are meant for oral use. For example, simple compressed tablet, then double compressed tablet, delayed release tablet, chewable tablets, sugar coated tablet, okay, film coated tablets. So all these kind of tablets are entry coated tablet. Okay, in that also entry coated tablet. Okay, delayed release tablet, controlled release tablet. Okay, so all these kind of tablets they are taken orally. Simple compressed tablet, double compressed, delayed release, chewable tablets, sugar coated tablet, film coated tablet, entry coated tablet, sustained release tablet. So all these are taken by oral route. So they are known as orally ingested tablets. Then second class is nothing but the tablet which are used in the oral cavity. So what are the kind of tablet which are used in the oral cavity? So there are buccal tablet. Buccal means these kind of tablets they are placed in the pouch. Okay, in the pouch between teeth and cheeks. आपका जो cheeks है teeth है उसके बीच में जो छोटा सा space होता है जो pouch बनता है वहाँ पे मुंह में. So in that pouch you have to place this kind of buccal tablet. Okay, they are meant for their slow dissolution. Okay, then sublingual tablet. So these kind of tablets you have to place below the tongue, and from that there is absorption of drug from capillary network below the tongue. आपके टंग के नीचे कैपिलरी नेटवर्क होता है. Okay, so from that capillary network drug will be absorbed directly into systemic circulation. So sublingual route, sublingual tablet का एक याद रखो कि in case of sublingual route first pass effect is bypassed because here drug is directly going to your systemic circulation in case of sublingual tablet, because whatever mucosal lining of your mouth is there, whatever capillary network is there below the skin, below the tongue. So drug is absorbed through that capillary network and directly goes into systemic circulation. That's why there is no involvement of liver and all that, and that's why there is no bypass effect. Commonly used tablets by sublingual route. For example, your nitroglycerin tablet, isosorbide dinitrate tablet. So in case of angina pectoris, so mostly जो vasodilators होते हैं, they are used by sublingual route. Then again, there are other tablets like trouches and dental cone. Trouches, trouches, this is trouches, dental cones. Then again, yeah, then again trouches means what? Actually these are a kind of tablet which are made by using base as a sugar base as a candy. Okay? They are relatively harder tablet and they are meant for to dissolve slowly over there. Okay, these are the known as a trouches. Or you might have seen one dosage form known as a strepsils. They are known as a lozenges. Okay, trouches and lozenges are similarly, they are a similar dosage form, but only difference is nothing but the your lozenges they are made by molding mostly, and trouches they are made by compression. Okay, so trouches और lozenges क्या होता है? Lozenges मतलब आपका विक्स की गोली लो, हिचकिच दूर करो, स्टेप्सिल खाओ, गले की खराश मिटाओ, है ना. विक्स की गोली मतलब क्या है? विक्स की गोली इट इज नथिंग काइंड ऑफ डोसेज फॉर्म, इट इज नथिंग बट द lozenges. Okay, it is a lozenges. Trouches are exactly like lozenges, only the method of preparation is different. So in case of lozenges, यहाँ पे शुगर का शुगर कैंडी का जो सिरप बनाते हैं उसमें वो ड्रग एडिशन करके फिर उसको एक थोड़ा सा डिजायर्ड शेप में उसका मोल्डिंग मोल्डिंग जो मोल्ड्स होते हैं मोल्ड में बनाते हैं टैबलेट वो lozenges. So lozenges are mostly prepared by molding, trouches are mostly prepared by compression. Okay, that is the difference. And dental cones, dental cones are very small tablets. They are meant or they are used in a empty socket of your teeth. So after teeth extraction, अगर आपका कोई दांत निकल लिया, उसके निकलने के बाद में वहां पे जो सॉकेट बनता है, जो बचता है, उस सॉकेट में क्या होता है कि देयर इज अ accumulation of your food particles, or there is a that in that area there is a development of microbial growth. Okay, so to prevent that, so these kind of tablets are made, that is known as dental cones. Okay, now tablet used in the other routes. So for example, here there are rectal tablet, sometimes they are also known as a tablet suppositories. Rectal tablet meant for insertion of into rectum. Then this vaginal tablets, mostly the antibiotic, antibacterial and antifungal drugs, they are given by they are formulated as a vaginal tablet. Because in case of woman, so what happens, the as we have said, in case of female, so female urethra is less, it is a less than male urethra. Male urethra is a relatively longer than female. So as female urethra is a short, so it there is a chances, that's why there is a frequently infection of female UTI. फीमेल का यूरेथ्रा में इन्फेक्शन ज्यादा होता है, so that's why so vaginal tablets are developed, vaginal tablets are formulated. Most commonly the drug, which kind of drug? Antibiotics, antifungal, anti-inflammatory, etc. Then transdermal implants. So what do you mean by transdermal implants? These are also very small tablets, like 8 mm in the diameter. They are formulated as a sustained release formulation, and they are meant for implantation. They are meant for the placing the tablet below the skin. So transdermal implants, so you have to just simple carry a small सर्जरी, एक छोटा सा सर्जरी करके स्किन के अंदर एक बार उसको टैबलेट को डाल देंगे. So they are formulated with the biodegradable polymer. So transdermal implants, they are formulated with the biodegradable polymer. So long acting drugs, for example, hormonal drugs, so they will release the hormone over a longer period of time after implantation. That is implantation. Remember, orally there are different kind of tablets which are taken orally, like compressed tablet, simple compressed tablet, double compressed tablet, delayed release tablet, in chewable tablet, sugar coated tablet, film coated tablet, entry coated tablet, sustained release tablet, control release tablet. So these are the tablet taken orally. Now tablet placed in the cavity like buccal tablets, sublingual tablet, pouches, lozenges, dental cones, etc. etc. Then tablets used for other routes like rectal tablet, vaginal tablets, tablet implants. Okay, so it is just overview of your classification of tablet. Now you can see what next we'll see types of tablet in the detail, little bit detail. So whatever we are saying, it was just overview. Now little bit in the details. इतना भी डिटेल में नहीं लेंगा कि पूरा के पूरा ये जैसे सेमेस्टर में होता है वैसा नहीं. Now first tablet used in the tablet for oral use. So oral use के लिए जितने tablet है कौन से okay. First one is nothing but the compressed tablet. First one is nothing but the compressed tablet. So what is compressed tablet? Drug with excipient. It is simply the granulation is done. Drug with excipient. The granulation is done and they are compressed. So it is nothing but the simple compressed tablet. Okay. Now multiple compressed tablet. Now if you are if you are having simple compression, then why you have to go for multiple compression? Now multiple compressed tablet means what? So initially what happens with the limited amount of granules, so you have to perform a compression, and after that again you have to fill the dye, and again you have to fill the again you have to compress the tablet. Okay, so that is known as a multiple compression. So in that you have double or triple. Okay, so double compressed tablet or triple compressed tablet, they are there. Okay, they are known as a bilayer tablet or multi-layer tablet. Now why you have to do this? To prevent the incompatibilities when two material they are okay they are present in the tablet. जैसे मान लीजिए कि आपके दो ड्रग हैं एंड बोथ दीज टू ड्रग आर इनकम्पेटेबल विथ ईच अदर. अगर वो एक साथ मिक्स किए तो वो उनका डिग्रेडेशन हो जाएगा, रिएक्शन हो जाएगा, या फिर उनका लिक्विफिकेशन हो जाएगा. So in that condition what you have to do? So you have to compress one drug separately little bit in the form of half tablet, and again remaining drug you have to compress on pre-formed half tablet. That is known as a multiple compressed tablet. So the main motive behind this multiple compression is nothing but the to prevent the incompatibility. इसके ऊपर क्वेश्चन आ चुका है. To prevent the incompatibility between two materials. So that's why you have to do multiple compress or double compress, triple compress. So in that you have different types like layer tablet. Okay, so there may you may have two layers. आपने देखा होगा कभी कभी एक लेयर में पिंक कलर आता है, दूसरे लेयर में व्हाइट कलर आता है. So why that is? Due to there is a first basic first incompatible two incompatible if two incompatible drugs are there. So first drug is pre-compressed as a half compressed tablet, and after that another drug is compressed as a half compressed tablet. Finally both these half compressed tablet final compression is done, so that there is a formation one tablet only, but these tablet can support two layers. So due to incompatibility, due to another reasons are also. For example, if you want one layer to be dissolved immediately in the stomach, okay, and one layer uh, to be dissolved in the to be dissolved after some time. So if one layer is immediately dissolved and one layer is delayed, okay, so such kind of arrangement also is possible in this layer tablet. Okay, again if you want to release if you are formulating two drugs, तो दो ड्रग का फॉर्मूला है आपका, दो दो ड्रग है एक ही टैबलेट में, और आपको एक ड्रग रिलीज करना है स्टमक में और एक ड्रग रिलीज करना है आपको इंटेस्टाइन में. अभी अगर मान लीजिए कि दोनों अलग अलग टैबलेट बनाए तो उसका कॉस्ट भी बढ़ता है. तो इफ यू फॉर्मुलेट दोज टू ड्रग सेपरेटली it will cost you more. Okay, so just formulate there's two drug in one tablet only by using multiple compression. So what will happen? One layer will dissolve in the stomach and one layer will dissolve when it will reach to intestine. Such kind. Okay, so in such cases you require a different kind of layer tablet. So in this case a tablet within a tablet, that is known as a bilayer tablet. Tablet within a tablet known as a multi-layer tablet. Okay, so multi-layer tablet means what? Tablet within a tablet or tablet within a tablet. मतलब देखो यार ये इसके ऊपर भी क्वेश्चन आ चुका है. मल्टी लेयर tablet, tablet within a tablet मतलब एक tablet के अंदर दूसरा tablet है, और tablet within a tablet मतलब एक tablet के अंदर दूसरा है और दूसरे के अंदर और एक छोटा दूसरा है. So tablet within a tablet or tablet within a tablet known as a multi-layer tablet. Okay, so compression of pre-compressed core material core in a shell, and it is more preferred in the compression coating. So it is also sometimes this multiple compression is also used for the coating of tablet, mostly tablet for local effect in the GIT. Then compression coated tablet. Okay. So as I have told, this multiple compression may be used for coating of tablet. So compression coated tablet. So it is done in the three principal design: compression coating, then Colton model and Stokes model. अभी ये क्या होता है क्या नहीं है इसके बारे में ज़्यादा ध्यान मत दो, बस याद रखो compression coating जो होता है उसके थ्री डिफरेंट डिजाइन होते हैं. तो compression coating, Colton model, Stokes model एंड मेसेंट्री ट्राइकोटा मॉडल. तो compression coating के तीन मॉडल होते हैं. फर्स्ट वन है कौन सा? फर्स्ट वन इज Colton model, then Stokes model and mesentery tricota model. Okay, so these are the different models of machine. That is a compression coating machine. Okay. Now next part is the delayed release or sustained release and entry coated tablet. So there is a little bit difference in these terms. What is mean by delayed release? What do you mean by sustained release? What do you mean by entry coated? Okay, so there is a difference. So I will explain this. So delayed release. Delayed release means what? So simple compressed tablet will release the drug in a 30 minutes. अगर सिंपल कॉम्प्रेस टैबलेट है वो आपने ले लिया तो वो स्टमक में जाके विद इन 30 मिनट ड्रग रिलीज कर देगा. नाउ डिलेड रिलीज मींस व्हाट? सो यू हैव टू डिले द रिलीज ऑफ दैट ड्रग by 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 coating or by including various kind of polymers, etc. Okay, so if you are delaying the release of that drug, that is known as a delayed release. So delayed release is done to bypass the stomach and release the drug into intestine. So if you don't want drug to be released in the stomach, because अगर आपका drug जो है if it is a degraded by gastric acid, you will have to formulate that drug in a either entry coated tablet or delayed release tablet. Such a release tablet is nothing but it will release the drug for a longer period of time. So delayed release मतलब क्या है? वो आप कुछ टाइम के वो टाइम डिलेड मतलब वो आप टाइम आएगा. जैसे नॉर्मल टैबलेट का 30 मिनट में ब्रेक होके ड्रग रिलीज करेगा. तो डिलेड रिलीज क्या करेगा? ये 45-60 मिनट लेगा. बट सस्टेन रिलीज मींस व्हाट? सो इट विल रिलीज ए पर्टिकुलर drug for a longer period of time. Longer period of time. It is formulated with a different kind of polymers. Okay. So to get a action for longer period of time, that is nothing but a sustain. Now what is meant by entry coating? Entry coated tablet. So entry coating means what? It is done to prevent the irritation if your drug is irritant to your stomach. कोई ड्रग है आपका वो इरिटेट करता है आपका गैस्ट्रिक म्यूकोसा. So in that case you can formulate that drug in an entry coating tablet. Okay, by using entry coating polymers. Then again it is also done when desired target of drug release in the intestine. अगर आपको ड्रग इंटेस्टाइन में ही रिलीज करना है, आपको गैस्ट्रिक एसिड में रिलीज नहीं करना है क्योंकि वहाँ पे डिस्ट्रक्शन होता है या फिर वो इरिटेट करता है, या फिर आपको सिर्फ इंटेस्टाइन में रिलीज करना है क्योंकि उसका एक्शन इंटेस्टाइन में. सो डिजायर्ड एक्शन इफ इट इज इन इंटेस्टाइन, so you can release the drug only in intestine by doing entry coating. So entry coating polymers are used. For example, cellulose acetate phthalate. Okay, so that polymer is nothing but the pH dependent polymer. So this polymer will not release a drug in the stomach; it will release a drug in the intestine. So that is known as entry coating. Okay, and also okay entry coating. So delayed release, sustained release, and entry coating. Now sugar coated tablets. Okay, so sugar means like your sugar, like your sucrose, okay, mannose, etc., maltose. So several sugar coats are okay, several sugar coats are there on the tablet. टैबलेट है आपका, उसके ऊपर बहुत सारे शुगर के कोटिंग करेंगे. इन दिस केस सी sugar, in case of sugar coated tablets, sugar coating because of the several impartation of because of the several sugar coats, it can increase in the weight of tablet. जो ओरिजिनल टैबलेट है आपका कॉम्प्रेस टैबलेट, अगर मान लीजिए कि 25 मिलीग्राम का है और उसको शुगर कोटिंग किया, so sugar coated tablet increases the weight of original tablet by twice. So it can increase the weight up to 50%. इसके ऊपर भी क्वेश्चन आ चुका है. So remember, sugar coating of tablet will increase the weight by 50%. Mostly it is used for vitamins and multivitamin preparation. You might have seen, अगर आपको मार्केट में कभी ड्रग प्रिस्क्राइब किया मालूम है, so there is one multivitamin tablet known as Supradine. There is a multivitamin tablet known as a Supradine, and that tablet is a sugar coated tablet. And this before sugar coating of tablet, there was a chocolate coating of tablet. But nowadays, because of the chocolate coating, kids may misinterpret that tablet as a candy and they may engulf. So that's why sugar chocolate coating of tablet is nowadays absolute or withdrawn. So sugar coated tablet means was several coats of sugar on the tablet surface, and it can increase the weight of original tablet up to 50%. This was again as it is question in the GPAT. Mostly it is used for multiple tablet preparation. It was again a question in pharmacy exam. Then next question nothing but the film coated tablet. Film coated tablet. So here film means what? Here is a relatively thin film of polymer on a tablet. Okay, so coating of tablet with a thin film of polymer. Now what is the reason? To prevent, to increase the palatability, to mask the odor, to mask the bitter taste, etc., etc. So film coated tablet for masking of your odor, masking of your taste. So there is a thin film over the tablet. Okay, that is known as a film coated tablet, and it is done by using film coating polymers like for example HPLC, हाइड्रोक्सी प्रोपाइल मिथाइल सेलुलोज. ठीक है, इसके ऊपर क्वेश्चन आ चुका है जीपैट 2020 में. तो ये व्हाट इज द यूज ऑफ HPMC? सो इट इज यूज्ड एज अ फिल्म फॉर्मर. तो ये बाद में अपन देखेंगे. सो रिमेंबर फिल्म कोटेड मींस व्हाट? देयर इज अ रिलेटिवली thin film on a surface of tablet, okay, to prevent the, to mask the taste of tablet, to mask the odor of tablet, or to prevent the contamination, or to make the tablet, or to make the tablet impermeable for the vapors and environment. Okay, so that is the aim of film coating of tablet. Now next one is a chewable tablet. Chewable tablet means what? So these are the tablet which are intended to chew in the mouth. ये क्या करेंगे, आपको सिर्फ च्यू करना है, उसको उसको निगलना नहीं. दे आर नॉट इंटेंडेड टू engulf, they are intended for the chewing in the mouth, chewing in the mouth. So in case of throat infection, in case of local action, etc. So in case of patient having swallowing problem, तो अगर कोई पेशेंट को swallowing का प्रॉब्लम है तो उसमें क्या करो, chewable tablet वो chew करते बैठेगा, that will be slowly dissolve. See, in case of compressed tablet and this type of tablet, and all that, so you are engulfing the tablet. The patient is engulfing the tablet, patient is swallowing the tablet. But chewable tablet, they are not meant for swallowing, they are only meant for to chew in the mouth and to dissolve slowly. They are not intended to disintegrate. ये बाकी के tablet disintegrate हो जाएंगे. ये chewable tablet जो है, that is not meant for, that is not meant for disintegration. Okay, and that's why disintegration test is not applicable for chewable tablet. This was again question in यहाँ पे याद रखो, डिसइंटीग्रेशन टेस्ट जो होता है च्यूएबल टैबलेट के लिए एप्लीकेबल नहीं होता है. सो दैट्स व्हाई. सो च्यूएबल टैबलेट्स दे आर मेंट टू डिसॉल्व स्लोली इन द माउथ. ओके, एंड दे मे एक्ट locally as well as there may be systemic action. So they are intended to chew in the mouth slowly. For example, aspirin tablet, most of the antacid tablet they are formed in the chewable tablet. Okay, now first pass effect is bypassed to a quite some extent. ठीक है, जो आपने च्यू किया है वो अगर लोकल से ही एब्सॉर्ब हो गए, वट एवर यू आर च्यूइंग, so that is absorbed through oral mucosa, so that drug is directly going to into systemic circulation. But so if you engulf or if you swallow that whatever the content is there in the stomach, that can cause specific. So mannitol is most commonly used sweetener in the chewable tablet. इसके ऊपर भी क्वेश्चन आ चुका है. So one of the following is a most commonly used tablet sweetener, most commonly used sweetener in the chewable tablet. Directly दो तीन बार क्वेश्चन आया. mannitol, remember mannitol is the most commonly used tablet diluent or sweetener in the chewable tablet. okay, क्वेश्चन आ चुके हैं इसके ऊपर, याद रखो ये. most commonly used diluent or sweetener in the chewable tablet, that is nothing but the mannitol. because this mannitol has a one more advantages. तो mannitol को और एक एडवांटेज होता है कि mannitol जो है it will cause cooling sensation in the mouth. so ये स्वीट तो होता ही होता है लेकिन कूल भी करता है. जैसे आपने मिंट की गोली खाई, so if you had taken a mint tablet, okay, so at that time such kind of sensation this mannitol imparts. so mannitol is the most commonly used sweetener in the chewable tablet. ठीक है, याद रखो mannitol, because it is a sweet as well as it will cause cooling sensation in the. So we'll see next point. Okay, Now tablet used in the oral cavity. We have seen the tablet you orally used. Now tablet those which are used in the oral cavity. Now in this case you have buccal tablet. So as I have told you is relatively small tablet, relatively flat in size. फ्लैट साइज का टेबलेट होता है और वो टेबलेट आपको हेल्ड करना है, आपको चिक और आपका चिक और टीथ के बीच में जो पाउच बनता है उसमें आपको हेल्ड करना है. So buccal tablets it is held between teeth and cheeks, that is known as cheek pouch. So some part of drug may be directly absorbed into systemic circulation. So if you swallow the that saliva and all that, so that can have a first perspective. Then next one is sublingual tablet. So tablet placed under the tongue. So if you place a tablet under the tongue, okay, so your tongue is supplemented with the network of capillary, blood vessel है टंग के नीचे. So वहाँ पे place करना है tablet. वहाँ से क्या होगा? So directly from the tablet it will be dissolved in the it will dissolve in the saliva and fluid, and it will be absorbed into systemic circulation directly into blood. Now it is held or placed below the tongue, and this is the most commonly used for angina pectoris. So most commonly vasodilators they are formulated as a sublingual tablet for the treatment of angina pectoris. First pass bit is a bypass. Remember, first pass bit is a bypassed by sublingual. They are also designed to disintegrate and dissolve slowly. Mostly buccal tablet they are designed to disintegrate or dissolve slowly. A sublingual tablet again same. Remember यहाँ पे. Then next one is lozenges or trouches. So lozenges means what? They are known as a cup drop. So Vicks cup drop. Vicks की गोली लो, खिच दूर करो. तो जो बोलते हैं that is a it is a kind of tablet. It is known as the lozenges. Now these lozenges are they are formed with the sugary base. It is formed by candy base, okay? Sugar candy base. So drug along with the sugar candy they are molded. Molded मतलब वो वहाँ पे क्या रहेगा? उसका डाइस रहेगा. डाई मतलब साचा. साचा रहेगा उसमें वो टैबलेट बनाएंगे. तो विक्स की गोली, ठीक है. उसके बाद में आपका ये क्या था क्या? Strepsils. Strepsils is also known as lozenges. Okay, lozenges mostly they are either compressed or molded. Trouches they are mostly prepared by molding. Okay, I was so trouches they are made by molding only, and lozenges they can be prepared by either molding or by compression. So again यहाँ पे अगर वो mouth they are meant for local effect in the throat. For example, in case of throat infection, you are using Strepsil. In case of throat infection, you are using Vicks. So they are meant to dissolve slowly in the mouth and to exert the action in the mouth as well as near to the throat. They are formulated with the sugary base, okay? That is known as candy. Then next one is a dental cone. Dental cones they are, as I have told, they are designed or they are prepared to place in the empty socket remaining after tooth extraction. तो आपका अगर दांत निकल लिया तो आपके दांत की जगह पे उसका जो सॉकेट रहता है उसमें क्या होता है कि देयर आर चांसेस ऑफ गेटिंग bacterial growth in that socket. There are chances of getting food particle entrapped. There are chances of getting food particle in that socket collected. That can prove that can also increase the bacterial growth. So to prevent that, dental cones are used. Mostly consist of antibacterial. Now again, tablet. Third kind of tablet is nothing but the tablet administered by other routes. So in that you have first vaginal tablets. Okay, so they are having ovoid or pear-shaped tablet. They are meant for to retain in the vaginal cavity. Mostly they consist of antibacterial drugs, antibacterial antifungal drugs. And pH is very important criteria while designing the vaginal tablets, because in the vaginal fluids the pH range is different. Okay, little bit acidic. वहाँ पे little bit acidic pH होता है. And if your tablet pH is different than vaginal pH, then what will happen? There will be irritation in the that area, so it will irritate your cavity. Okay, so that's why the pH is very important consideration over there. Again, they are also meant for local effect only. From that part it will not be absorbed systemically. So whatever antibiotics you are using through a vaginal tablet, so that will they act on a locally, okay, they will act on a locally on mucous surface of vagina. Then again, टैबलेट इम्प्लांट्स, नेक्स्ट वन इज टैबलेट इम्प्लांट्स। इसका अपने मार्केट में बहुत सारे टैबलेट अवेलेबल है। कैंडिड टैबलेट्स, so candid tablet, candid v6 tablet, candid v6 tablet is example of vaginal. Then implants, implants, these are the tablets, okay, these are the, they are again a tablet, cylindrical in nature or rosette shaped in nature, and they are very small in size, not more than 8 millimeter, not more than 8 mm. They are meant to place below the skin, okay. So by making a small surgery, the tablet is placed below the skin and it will release the drug for a longer period of time. That is known as an implant. Nowadays, there is a one injector known as a kern injector. Kern injector. They can ask you a question on this. Kern injector is used to inject the implant, and it is replaced by it is okay, and it is okay. Now the tablet is controlled by silicone tube filled with the drug, okay, or biodegradable polymer. जैसे मान लीजिए कि इम्प्लांट डाला है आपने, ठीक है, इम्प्लांट डाला है उसको, उसमें क्या है, मैग्नेटिकली एक्टिव कैप्सूल है। सो आपको क्या करना है कि जैसे डॉक्टर ने बोला है आपको कि एट अ स्पेसिफिक पीरियड ऑफ टाइम विद इन अ 1 मंथ, तो 1 महीना हो गया, उसके बाद क्या करो, वो मैग्नेट ले लो और थोड़ा सा हल्का सा वहाँ पे घुमाओ, दैट विल रिलीज द ड्रग। Implant means what? Tablet implant should be cylindrical or rosette shaped or should not be more than 8 millimeter in size. Kern injector is used to inject the implant. Again, implants are replaced nowadays by a defined control silicone tube filled with the drug or biodegradable polymer along with your drug. They will act for a longer period of time, okay? Long duration from few months to, now next part is nothing but the, again, tablet used to prepare the solution. नेक्स्ट पार्ट इज नथिंग टैबलेट व्हिच इज यूज्ड टू प्रिपेयर द सॉल्यूशन। तो ये टैबलेट जो होते हैं इसका सॉल्यूशन बनना है, टैबलेट जो है लेके इसका सॉल्यूशन बनना है। इसमें के अंदर कौन सी टैबलेट आती है देखो। सो इपरमेसन टैबलेट इज देयर, डिस्पेंसिंग टैबलेट इज देयर, हाइपोडर्मिक टैबलेट इज देयर, टैबलेट ट्राइचुरेट्स। ओके, सो दे हैव ऑलरेडी आस्क्ड द क्वेश्चन ऑन दिस आल्सो इन द वेरियस एग्जाम, लाइक फार्मेसी एग्जाम में कुछ आए, आपका जीपैट में भी पूछा है। सो व्हाट इज मीन बाय इपरमेसन टैबलेट? सो these are the tablet, they are designed to dissolve with release of carbon dioxide, okay. When you place this kind of tablet, effervescent tablet, in a water, so what will happen, they will dissolve with the releasing carbon dioxide, okay. So effervescent tablet, they are formulated with the content like mixture of citric acid, tartaric acid, sodium bicarbonate, citric acid, tartaric acid and sodium bicarbonate। ये तीनों को अगर मिक्स करेंगे तो इनमें रिएक्शन हो जाता है। जैसे ही वाटर में ये डालेंगे आप, उसमें रिएक्शन हो जाता है और सोडियम बाइकार्बोनेट, टर्ट्रिक एसिड, साइट्रिक एसिड, ये रिएक्ट होते हैं और कार्बन डाइऑक्साइड रिलीज करते हैं। नाउ व्हाटएवर रिलीज कार्बन डाइऑक्साइड इज देयर, दैट विल मास्क द टेस्ट ऑफ दैट solution, okay. So that carbon dioxide release, that will mask the taste, and it will also have bubbles in the that solution, that will also look like, okay. So that produces a clear solution and pleasant flavor, okay. Mostly the taste is masked by carbon dioxide, release of carbon dioxide. And mostly these effervescent tablet, they are formulated for antacids and particularly systemic antacid. So if you have seen one powder known as eno, अगर आपने इनो देखा होगा, इनो बुलबुले, ठीक है, वो मस्त पैके ग्लास में लेके उसमें आप डालते हो और बाद में पीते हो बुलबुल, बट इट इज अ systemic antacid, so it can cause systemic alkalosis. So whatever effervescent tablets are there, mostly they are made up of a mixture of citric acid, tartaric acid and sodium bicarbonate. Now this is sodium bicarbonate, it is a basic, it get absorbed in the systemic circulation, or other metals also get absorbed in the systemic circulation and can produce systemic alkalosis. Systemic alkalosis मतलब क्या, कि ब्लड का पीएच आपका जो है वो बढ़ा देगा, 7 to 9 जो है आपका 7.4 जो पीएच का ब्लड है उसको बढ़ा देगा, ठीक। सिस्टमिक एसिडोसिस मतलब क्या, वो पीएच अगर कम है आपका 7.4 से अगर कम है पीएच, तो उसको बोलेंगे सिस्टमिक एसिडोसिस। यूरिनरी एसिडोसिस मतलब क्या, अगर यूरिन का पीएच कम हो गया नॉर्मल से तो उसको बोलेंगे यूरिनरी एसिडोसिस। यूरिनरी अल्कलोसिस मतलब क्या, यूरिन का पीएच अगर नॉर्मल से बढ़ गया तो उसको बोलेंगे यूरिनरी अल्कलोसिस, ओके। दैट इज अनदर। नाउ that is effervescent tablet. Remember the content of effervescent tablet, they can ask question on this. So it consists of citric acid, tartaric acid, sodium bicarbonate. इसके ऊपर क्वेश्चन आ चुके हैं फार्मासी एग्जाम में, ऑथर एग्जाम। एंड effervescent tablet, they are mostly formulated with the antacids. तो इनको क्या करना है, टैबलेट लेके एक गिलास पानी में ड्रॉप करना है, बाद में क्या होगा कि वहां से कार्बन डाइऑक्साइड रिलीज होगा, बुलबुले फॉर्म हो जाएंगे, that will mask the taste and it will produce a pleasant and clear solution. So effervescent tablet. Now dispensing tablet means what? They are sometimes known as a compounding tablet. So इसको compounding tablet भी बोलते हैं. Some dispensing tablet, they are also sometimes known as a compounding tablet. So these are the tablets which pharmacist has to make on the demand. If the patients are there, if a patient has prescribed certain kind of tablet, and these type of tablet mostly consist of a potent drug, okay, and potent drug, so they have to dispense it as and when required. Okay? So dispensing tablets are made to dissolve in a specific volume of water, and this drug or dispensing tablet consists of water soluble ingredients. So dispensing tablet means what? Dispensing tablets are made to dissolve in the water in a specific volume of, and it consists of a specific water soluble content. उसमें सब water soluble component होगा, additives, drug होगा, सब water soluble. Then next one is a hypodermic tablet. Hypodermic tablet. Okay, what do you mean by hypodermic tablet? So it is a tablet again dissolved in the sterile water for a injection, immediately for injection. तो ये hypodermic tablet क्या होता है कि ऐसा tablet होता है जो आपको tablet लेके sterile water for injection में dissolve करना है और उसका injection मार के. So hypodermic tablet इसके ऊपर क्वेश्चन आ चुका है GPAT में. So tablet, it is a dissolved in a sterile water for injection immediately for. Then again tablet triturates. So they are nothing but the tablet which are molded tablet. They are made by molding method. And mostly these consist of alcohol as a. They are not now. They are not used nowadays. They are absolute nowadays. These are the types of tablet. Now next one is nothing but the various excipient used in the tablet manufacturing. As I have told you, tablet is nothing but the unit solid dosage form made by compression or molding. Now your tablet is not only having your drug, it is having some kind of excipients or additives. So what do you mean by additives? So आपका अगर बहुत ही ज़्यादा bitter टेस्ट वाला ड्रग है या फिर कोई पोटेंट ड्रग है, जैसे मान लीजिए इपेट्रिन हाइड्रोक्लोराइड. So इपेट्रिन हाइड्रोक्लोराइड, it is a formula. What is the dose? 1 milligram. So you cannot formulate a tablet of 1 milligram. 1 milligram तो आपको वे भी करना है, तो उसका टैबलेट कैसे बनाएंगे? So for that, to increase the bulkiness of your tablet, so various kind of dilutes are used to increase the palatability. Various kind of dilutes are used like colorant, etc. To mask the taste, various kind of coating is used or various sweeteners are used. So we will see one by one various tablet excipient used in the tablet manufacturing. Fillers or diluent. And what is the function of fillers or diluents? They increases the bulkiness of your tablet. इसके ऊपर भी क्वेश्चन आ चुका है. One of the following category of tablet excipient will increase the bulkiness of tablet. So dilutes or so most commonly used these dilutes are nothing but the lactose USP, anhydrous lactose, freidide lactose, directly compressible starches, hydrolyzed starches, microcrystalline cellulose, diabasic calcium phosphate, mannitol, sorbitol, calcium phosphate, dihydrate, and dextrose. They are known as the fillers or diluent. They will increase the bulkiness of your tablet. अगर आपके टैबलेट में 1 मिलीग्राम का ही ड्रग है तो 1 मिलीग्राम का टैबलेट बना ही नहीं सकते आप. बहुत ही मतलब कैसे बनाए, तो 1 मिलीग्राम का टैबलेट भी बनाया तो उसमें एक्सिपिएंट वगैरह यूज करके उसका टोटल वेट कितना होता है, तकरीबन 10 मिलीग्राम, 5 मिलीग्राम. So to increase the bulkiness of your tablet, these fillers or diluents are used. Okay? Like lactose, I have to. Now again, binding agent. Okay. Next one is a binding agent or binder. So binding agent, what is the role of binding agent? So they are used to promote the adhesiveness. They are used for the increasing the adhesion, okay, between particles. So what kind of they are used? Acacia cellulose derivative like, okay, then gelatin, glucose, polyvinyl, pyrrolidone, PVP, starch, pre-gelatinized starch, sodium alginate, sorbitol, and trigon. So mostly they are used as a binding agent to hold the powder together. So for example, in case of wet granulation, so binding solution is used. Wet granulation में क्या होता है कि binding solution जो भी आपका पाउडर है मिक्सिंग करने के बाद में ड्रग प्लस स्टार प्लस जो भी आपका एडिटिव्स है, बाइंडिंग एजेंट, डिसइंटीग्रेटिंग एजेंट, उसके बाद में कलरेंट, जो भी फ्लेवरिंग एजेंट, जो वो सब मिक्सिंग करने के बाद में ब्लेंडिंग करने के बाद में आपको ग्रैन्यूल्स बनाना है. तो इन दैट केस यू हैव टू use the binding agent like acacia solution, okay, or starch solution. That is the binding agent. Now what is meant by disintegrating agent or disintegrant? Disintegrating agent or disintegrant. Disintegrant, they are used to break the tablet. ठीक है, कि आपका आपने जो टेबलेट बनाया वो आपके स्टमक में जाने के बाद में, आपके जीआईटी में जाने के बाद में वो ब्रेक भी होना चाहिए. अगर वो ब्रेक नहीं होगा, डिसइंटीग्रेट नहीं होगा, so how the tablet will release the drug? So drug, if drug is not released, then what is use of the tablet? So that's why to promote the breakdown of tablet in the GIT, so you use disintegrant. So to break down the tablet, for example, starch is used, cellulose is used, then cross-linked carmelose is used, polyvinyl pyrrolidine, then alginates. So these are the known as a disintegrant. Glidant, what do you mean by glidant? To improve the flow of granules from the hopper. सपोज आपके ग्रेन्यूल्स आपने बनाए और टैबलेट पंचिंग मशीन की जो हॉपर पार्ट होता है सबसे ऊपर, उसमें ग्रेन्यूल स्टोर करते हैं, उसमें रखा है ग्रेन्यूल्स, लेकिन वो ग्रेन्यूल्स नीचे आ ही नहीं रहे, डाई कैविटी तक आ ही नहीं रहे, बिकॉज द ग्रेन्यूल्स आर वेरी हैविंग वेरी रफ सरफेस. वो ग्लाइड नहीं हो रहे, वो आप स्लाइड नहीं हो रहे, वो नीचे फ्लो नहीं हो रहे. सो टू इम्प्रूव द फ्लो, ग्लाइडेंट्स आर यूज्ड. टू इम्प्रूव द फ्लो, ग्लाइडेंट्स आर यूज्ड. इसके ऊपर बहुत बार क्वेश्चन आ चुके हैं कि कौन सा काम किसका है. So what kind of glidants are there? Silica derivative like colloidal silicon dioxide. So ऐसा क्वेश्चन पूछते हैं, colloidal silicon dioxide is used as a tablet excipient. What is the role of, और नीचे ऑप्शन में आएगा binder, disintegration agent, disintegrant, then a filler or glidant. Glidant answer होगा. So such kind of question they used to ask. So remember silica derivative, colloidal silicon dioxide, talc, cornstarch. It is known as a glidant. Now next one is anti-adherent. Anti-adherent मतलब क्या? So in the tableting machine, so due to its continuous punching and all that, so there is a formation of very fine powder, and that get deposited in the various parts and on your tablet also. So to prevent that, anti-adherents are used. For example, magnesium stearate, starch, and talc. Then lubricant. Lubricant means to reduce the friction of machine and its component. That is the function of lubricant. What is the examples? Your stearic acid derivative, propylene glycol, again surfactants and waxes. These are the example of lubricants. Now coloring agents, coloring and flavoring agent. Drug and cosmetic, FD&C. FD&C is food, drug and cosmetic. And drug and cosmetic dyes and lakes. So those are approved by US FDA or that. So these kind of dyes, मतलब colors हुए, like panache, etc. Tartrazine, yellow. कलर में टैबलेट में कलर भी आता है, येलो कलर का टैबलेट है, ब्लू कलर का है. ये अगर ब्लैक कलर का टैबलेट होगा तो आपको लेंगे नहीं ना उसको. To increase the aesthetic value, to increase its elegance, aesthetic value. So coloring and flavoring agent particularly used for the masking the taste. So like flavoring is like your mint flavor is there, orange flavor is there, so strawberry flavor is there, raspberry is there, so a lot of flavors are there. Okay, so coloring and flavoring agent, food, drug and cosmetic, drug cosmetic dyes, lakes, spray dried and other flavors, natural and artificial. So they includes under the coloring and flavoring agent. Yeah, I will save the recording once. Some multiple use excipient, कि कुछ excipient जो यूज होता है टैबलेट में, जैसे ये सेलुलोज हो गए, ग्लिसरीन, सेलुलोज हो गया, सेलुलोज उसका दो तीन यूज होता है. So cellulose in a different concentration will act as a binding agent. In different concentration it will act as a control release excipient. In different concentration it will act as a pill former. Okay, so that is known as a multiple use excipient in the tablet. Okay, so first one is ethyl cellulose. Ethyl cellulose. Okay, it is used in the 1 to 3% in concentration. So it will act as a binding agent for wet as well as dry binding. So wet as well as dry granulation, it is used as a binding agent, and it is also control release. It is also used in the control release coating. Ethyl cellulose water insoluble होता है. ये क्या है? It is water insoluble. remember इसके ऊपर क्वेश्चन आ चुका है. So one of the following derivative is water insoluble. So ethyl cellulose is a water insoluble. Question आ चुका है इसको. Then glyceryl palmitostearate. So glyceryl palmitostearate is used as a lubricant in a concentration of 1 to 0.1 to 5%. So in concentration of 0.1 to 5%, lubricant is there. Glyceryl palmitostearate. Then it is also used as a control release excipient in a concentration of 10 to 50%. Then next one is the hydroxy propyl methyl cellulose or HPMC. Hydroxy propyl methyl cellulose. So it is known as a multi-purpose tablet diluent. और मल्टीपर्पज टैबलेट एक्सिपिएंट. रिमेंबर, जो HPMC होता है हाइड्रोक्सी प्रोपाइल मिथाइल सेलुलोज, इट इज नोन एज अ मल्टीपर्पज tablet because see it is also used as a binding agent, it is also a film former, it is also a control release excipient, okay? Control release excipient in a various concentration. Then magnesium stearate, so it is used as a binder as well as then okay, then microcrystalline cellulose. Sorry, this microcrystalline cellulose is known as a multipurpose dialog. ये जो माइक्रोक्रिस्टलाइन सेलुलोज है उसको बोलते हैं मल्टीपर्पज डायलूट, ये HPMC को नहीं. So microcrystalline cellulose is known as a multipurpose dilute, okay? Because this is used for film formation or film coating. Then it is also used as a glidant, also anti-adherent, then disintegrant. It is also a binder and filler. That's why it is known as a multi-purpose tablet dilute, microcrystalline cellulose. Next one is a polyethylene glycol. Polyethylene glycol. So it is used as a 0 to 1% concentration is used as a lubricant. Then it is also a thermoplastic filler or binder. It is also used as a control release excipient in the 5 to 40%. And the next one is a polymethyl acrylate. Polymethacrylate, okay? So it is a again film former, control release excipient, filler and tablet coating. Concentration याद नहीं रखा तो भी चलेगा, इतना डीप कोई नहीं पूछता. Now polyvinyl pyrrolidone, it is also known as a PVP, okay? So it is used as a weight binding agent, then coating solution excipient, then it is also a disintegrant and control release excipient. Starch, there are different kind of starch like maize starch, wheat starch, potato starch. Then they are used as a intragranular binding agent, granules को bind करने में. Then they are also used as a disintegrant, then they are also used as a weight binder, and weight binder, intragranular binder, disintegrant. Commonly used weight binder and granulating agents is those, it is known as a, it is used in the weight granulation. There are two types of granulation. तो टैबलेट्स में क्या है कि डायरेक्टली पाउडर आप कंप्रेस नहीं कर सकते. अगर आपका पाउडर डायरेक्टली कंप्रेसिबल है, अगर बाकी के एक्सिपिएंट भी डायरेक्टली कंप्रेसिबल है तो फिर डायरेक्ट कंप्रेशन कर सकते. बट इफ योर पाउडर इज नॉट डायरेक्ट कंप्रेसिबल, इफ other additives are not directly compressible, then what you have to, you have to make the granules form. To make the granules you have different methods, we will see it in upcoming slide. So dry granulation is there, wet granulation is there. So in case of dry granulation, so that we'll see in upcoming slide. अगर यहाँ पे बोलते बोलते होती है पिक्चर है. So those binding agent which are used in the wet granulation. wet मतलब जिसमें solvent होगा, जैसे most of them watery होता है लेकिन कभी-कभी ethanol भी यूज कर सकते हैं. So in the wet granulation, what are the different types of binding agent used? So first one is nothing but the gum acacia mucilage. Gum acacia mucilage. So अपना acacia gum होता है उसका 1 to 5% solution water में बना के it is used for wet granulation. It will produce hard kind of granulation, hard granules and friable granules. Then cellulose derivative, so they are also used in the 5 to 10% concentration. So hydroxypropyl methyl cellulose is the most common. Sometimes ethanol is also used. So it is easily applied. It is applied to those kind of material which is hydratable, which are easily hydrated, which the material is used to get easily hydrated. अगर कोई मटेरियल है कि वो जल्दी हाइड्रेट हो जाता है तो उसमें वाटर यूज नहीं कर सकते, तो उसमें इथेनॉल यूज, नाउ मोस्टली इथेनॉल यूज कर सकते. नाउ उसके बाद में जेलेटिन का सुलॉय यूज करते हैं. सुलॉय मतलब जैसे सॉल्यूशन या सूप टाइप 10 to 20%, and there is it gels in cold and strong adhesive used in the lozenges. So it will form a gel in the cool condition. It is a strong adhesive used in the lozenges. Then glucose syrup 25 to 50%. Again it is a strong adhesive. Okay. Now if it is used tablet में soften in a high humidity. अगर आपने इसको यूज किया ग्लूकोज सिरप को एज अ बाइंडिंग एजेंट और ग्रेनुलेटिंग एजेंट, so what will happen when there is a high humidity condition, at that time this glucose will get soft, ये melt हो जाएगा. Then povidone 5 to 15% concentration is used. Different grades of povidone is available. Starch mucilage best general binder, is the best general binder. The sucrose syrup again strong adhesive and may soften during high humidity. Tragacanth mucilage, it produces again hard friable granules uploaded. It is also used or uploaded for hydratable material. Okay. Now next super disintegrant. It is a very important part. इसके ऊपर भी कम से कम 4-5 बार क्वेश्चन पूछा है एक ही चार्ट के ऊपर. ठीक है. ये चार्ट एक्चुअली दिस काइंड ऑफ चार्ट इज यू विल नॉट फाइंड एनी बुक. मेरे बुक में ही है क्योंकि ये मैंने 2-4 बुक्स रेफर के बनाए. 2-4 बुक्स का कंटेंट एक ही चार्ट में. सुपर डिसइंटीग्रेंट के बारे में जितना भी इंफॉर्मेशन है 2-4 बुक एक ही जगह पे. सो सुपर डिसइंटीग्रेंट. So what is difference between disintegrant, normal disintegrant and super disintegrant? Basically what will happen if you use starch paste, normal starch paste or any disintegrant other than super disintegrant. So it will also disintegrate the tablet, but it will take a time. Okay? Like for example, it will disintegrate the when it will come into contact, it will take time to disintegrate the whole tablet. टैबलेट पूरा ब्रेक होने के लिए एक 10 मिनट लेगा या 15-20 मिनट लेगा वो पूरा डिसइंटीग्रेट करने के लिए. नॉर्मल सुपर डिसइंटीग्रेंट जो है वो विद इन 1 मिनट और विद इन फ्यू सेकंड it will break down the tablet. So that's why super disintegrant to release immediately. Okay, so drug will be released immediately when super disintegrant are used in the tablet. So what are the examples? First you will see. First one is a cross caramelose sodium. So cross caramelose sodium, it is known as a cross caramelose sodium. Cross caramelose sodium. So what is it? It is nothing but the cross linked cellulose. Okay, cross caramelose sodium. Then acdisol, then primulose, then solutab. So remember these four. Okay, cross caramelose, acdisol, primulose and solutab. ये चारों भी क्या है? इट इज नथिंग बट द क्रॉस लिंक्ड सेलुलोज. सेलुलोज में क्या होता है कि सेलुलोज इज नथिंग बट द पॉलीमर ऑफ योर ग्लूकोज प्लस जो स्टार्च होता है स्टार्च का ही बाद में सेलुलोज बनता है. तो क्रॉस कार्मेलोज सोडियम, एक्डिसोल, देन प्राइमेलोज एंड सोलुटेब. So these are the trade names of your cellulose. Okay, cross linked cellulose which is used as a super disintegrant. So cross caramelose, acdisol, primulose, solutab. These are the trade names. ये इसका trade name है. इसका तो ये क्या है exactly? It is a cross linked cellulose. What is the mechanism of disintegration? कैसे करता है? जैसे ये acdisol, caramelose, cross caramelose, primulose वगैरह ये जैसे ही कांटेक्ट में आता है वाटर की तो ये क्या करेगा? स्वेलिंग हो जाएगा. Okay, so for example, cross caramelose sodium. So when it will come into a contact with water, it will swell. It will swell 4 to 8 times less than in 10 seconds. When it will come in contact with the water, water कहाँ से आ गया? जैसे आपने टैबलेट ले लिया, गैस्ट्रिक एसिड में वाटर भी होता है ना, तो उसकी कांटेक्ट में आने के बाद ये क्या होगा? आने के बाद इमीडिएटली विद इन 10 सेकंड ये इसका स्वेलिंग हो जाएगा और स्वेलिंग के कारण क्या होता है? ब्रस्टिंग हो जाता है, वो टैबलेट टूट जाता है. So it will swell within the 4 to 8 times less than in 10 seconds and causes the release of drug. So it causes bidirectional swelling. Then this acdisol, primulose, solutab. So what is the mechanism behind these three? Again swelling and whacking. Again swelling and whacking. So out of that, this acdisol is a directly compressible and solute. Okay, and primulose is nothing but the starch free. Now second is nothing but the cross caramel. Okay, second is nothing but the povidone, cross povidone and collidone. Okay, cross povidone or collidone. So both are nothing but the cross linked pyrovinyl polyvinyl pyridone. Cross caramelose, cross povidone and collidone. Both are nothing but the cross linked polyvinyl pyridone. Okay. These again swells again when you come in contact with the water, they will get little but release the drug by its capillary reaction. What is the comment is also there? What is comment? So water insoluble is there and it will form a spongy in nature. It is a spongy in nature, and to get a it will form a tablet to get a porous tablet when it come into contact with water. जैसे ये क्रॉस पोविडोन कॉलिडोन है, ये कांटेक्ट में आएगा वाटर के, एक स्वेलिंग उसका कम होता है एज कम्पेयर टू बाकी सेलुलोज की तरफ, लेकिन ये क्या करता है? कैपिलरी रिएक्शन की वजह से वाटर को खींच लेता है एंड इट विल बिकम अ स्पॉन्जी इन नेचर. अगर ये स्पंज जैसे बन गया तो रिलीज होगा ड्रग. देन नेक्स्ट वन इज सोडियम स्टार्च ग्लाइकोलेट, क्रॉस लिंक्ड स्टार्च होता है इसमें, सोडियम स्टार्च ग्लाइकोलेट, देन एक्सपोटैप, देन प्राइमोजेल। ये तीनों याद रखो, सोडियम स्टार्च ग्लाइकोलेट, एक्सपोटैप, प्राइमोजेल, they are nothing but the cross linked starch, okay, cross linked starch। कार्मेलोज, सोल जिसमें आएगा सोलोटैप, प्राइमलोज, एंटिडीसोल, क्रॉस कार्मेलोज, इसमें सेलुलोज रहेगा। पोविडोन, कोलिडोन, डोन जिसमें आएगा उसमें क्या रहेगा, क्रॉस लिंक्ड पायरोविनाइल पॉलीविनाइल पायरोविनाइल। देन यहाँ पे सोडियम स्टार्च ग्लाइकोलेट, एक्सपोटैप, प्राइमोजेल, इसमें रहेगा क्रॉस लिंक्ड स्टार्च। व्हेन इट विल कम इनटू कांटेक्ट विद द वाटर, अगर आपने टैबलेट फॉर्मुलेट करते समय इसका यूज किया, सोडियम स्टार्च ग्लाइकोलेट, एक्सपोटैप, प्राइमोजेल, टैबलेट में ये है, जब आपका टैबलेट स्टमक में जाएगा इट विल कम इन कांटेक्ट विद द लिक्विड, so it will swell around 7 to 12 times more than original size and less than 30 seconds। तो ये जो starches है they are known as super disintegrant, they will swell 7 to 12 times of the original size and within a 30 second after contact with the water। The swelling is in a three-dimensional and serve as a matrix persistently, it can be served as a matrix persistently formula। Then alginic acid is also there, known as super disintegrant, it is a cross-linked alginic acid, so it will also swell when it will come into contact with water, and it is used for both dry as well as wet granulation, and that is used for promotion of disintegration। Now soya polysaccharide, so इसके ऊपर क्वेश्चन आया है, one of the following is a natural super disintegrant, ऐसा क्वेश्चन आ चुका है। सोया polysaccharide is a natural super disintegrant, so remember it does not contain starch। so क्वेश्चन आ चुका है कि one of the following is a natural super disintegrant, so soya polysaccharide। calcium silicate is also used sometimes for disintegration। now it is inorganic, ये क्या है, inorganic है, कौन सा, calcium silicate, so it is due to weakening action, optimum concentration 20 to 40%, it is highly porous। तो यहाँ पे क्वेश्चन कैसे आते हैं आपको, ये देखो, प्राइमिलोज is a super disintegrant used in the tablet and it consists of one of the following। वहाँ पे आपको देंगे क्रॉस लिंक्ड सेलुलोज, क्रॉस लिंक्ड पॉलीविनाइल पायरोलिन, वहाँ पे देंगे क्रॉस लिंक्ड स्टार्च और क्रॉस लिंक्ड आर्जेनिक एसिड, तो आपको समझ में आएगा। तो ये जो सोर्स है क्रॉस कार्मेलोज, एक्डिसोल, प्राइमोलोज, सोलोटैप, ऑल दीज आर द क्रॉस लिंक्ड सेलुलोज। स्वेलिंग मैकेनिज्म, ये मैकेनिज्म के ऊपर भी कोई नहीं पूछेगा आपको, एक आध बार पूछा तो पूछेगा, लेकिन इसका ट्रेड नेम एंड उसका कंटेंट क्या है, इसके ऊपर क्वेश्चन बहुत बार आ चुका। क्रॉस पोविडोन कोरिडोन कंसिस्ट ऑफ पॉलीविनाइल सोडियम स्टार्च ग्लाइकोलेट, तो इसमें तो स्टार्च आता है, तो सोडियम स्टार्च ग्लाइकोलेट में क्या होगा, स्टार्च होगा, तो ये तो छोड़ो, इसमें कंफ्यूजन होता है। एक्सपोटैप एंड प्राइमोजेल, so remember expotap, primozole, they are nothing but the cross linked starch। then arginic acid तो इसमें आएगा, cross linked arginic acid, ये समझ में आएगा। remember soya polysaccharide is the natural super disintegrant, calcium trisilicate is the inorganic super disintegrant। इसके ऊपर